Dear colleagues, dear friends, dear all people who are passionate about improving quality of life and well-being for people living with diabetes, I'm very honored to welcome you to the meeting of the Pakistan Endocrine Society at this World Diabetes Day in 2024. I'm Peter Schwarz and I'm the president of the International Diabetes Federation. And I must say, it's a great honor to talk to you. It's a great honor to talk to you about a topic which we have to change. Diabetes and well-being, this year's theme of the World Diabetes Day, is something what is very serious because we as healthcare professionals often have forgotten in the past about this topic. We focused on diagnosing, pharmacotherapy, managing diabetes, and looking for the outcome. But 70% of our patients, they report having a negative impact on quality of life due to diabetes. Actually, 80% report of having burnout during their lifetime related to diabetes, and 75% ask for help, social support due to the impact on quality of life, and most of them are not getting it. This has to change. This is what we have to change. We have to think how we can really make a difference to people living with diabetes all over the world, including Afghanistan, because in your region, there is a sudden increase in prevalence of diabetes due to lifestyle, due to accessibility and availability of diabetes care, due to the circumstances in the region. And I would like to strongly motivate you to think about what you can do in little steps, in large steps, in even larger steps to have a difference or to make a difference for people living with diabetes. So if you are thinking about your family, your friends, your environment, you might find people living with diabetes. Think about what you can do to have a positive impact on their quality of life. Or if you are the healthcare professional, as you're being also at this event, think about what you can do for your patients and think about how you can improve well-being, quality of life for those patients. Sometimes it starts with asking the question. And if you are a politician, if you are a stakeholder, if you are a policymaker, I would like to motivate you to think about what can a policy change or an environmental change or change in accessibility and availability of diabetes care have a positive impact on the life of people living with diabetes. So I'm very thankful to you to listening to this, and I'm very thankful to your interest, your passion, your motivation to change the life of people living with diabetes. For me, as president of the International Diabetes Federation, this is my heart beating for to do whatever we can do to improve the quality of care for people living with diabetes all over the world. And the circumstances are very different. If you are in Suriname or Afghanistan or Finland or the United States, the circumstances, the environment, the intuitive need of people living with diabetes is very, very different. And we have to address this. And there are environments with very good accessibility, but there are also environments with no accessibility of diabetes care in the world. And again, we have to change this. We should act. No one alone. We want to build, or the International Diabetes Federation wants to build a large community of people being active to improve quality of life, to improve the environment, the accessibility and availability of diabetes care for people living with diabetes. And I would like to invite you to join this community, and I would like to share some of the social media channels we have developed, or I have developed also to witness all the activities. So if you have your smartphone in your hand, may you take the chance and scan this QR code and you come to my WhatsApp channel where I want to report every day about the activities of the International Diabetes Federation to act, to improve quality of care, quality of life for people living with diabetes. And this means activity related to stakeholders in all countries worldwide, activities related to being in the pocket of every diabetes patient, so developing educational activities for people living with diabetes throughout their smartphone, and most of them fully for free. but also inviting you to be in your heart and building a large fellowship program of the International Diabetes Federation to build a community of healthcare professionals and to make all the offers of the IDF School of Diabetes for free to any healthcare professional to leverage the skills, to leverage our own ability to provide best available evidence-based care, also in low and very low income countries. And if you don't like the WhatsApp channel, there are more social media channels you can use. I would invite you to, together with me, together with the International Diabetes Federation, build a strong community to act on behalf of the quality of life for people living with diabetes. So it's a great honor for me to talk to you, and I'm passionate about it, and feel very honored that you celebrate the World Diabetes Day. And it does not matter. There's no wrong and right. Every little step to have an impact on the life of people with diabetes is good. And do the first step and do a second one and do a third one. Let's not only talk about, let's walk together to change the life of people living with diabetes. Thank you very much. Thank you for your action.